Okay, let's talk in depth about some of the athletes that participate in the long distance events for cross country, particularly the athletes who are in the sit ski because they have lower extremity function that is diminished because of a spinal cord injury. Now, these particular athletes are susceptible to a natural physiologic phenomenon called autonomic dysreflexia, or AD for short. Autonomic dysreflexia is something that occurs when the nervous system is getting a signal from something that is irritating them below their level of their spinal cord injury. For instance, if you have an ingrown toenail or maybe a full bladder, and that neurologic sensation is trying to go back up to the brain and back down to the signal, but it can't because of an injury in the spinal cord. Now, when this happens, there is a natural response from the cardiac system that's going to increase heart rate as well as blood pressure. Now, both of these factors can increase athletic performance. So, if you're wondering, is there an area of the Paralympic Committee that's regulating this so that it's not used for doping? The answer is yes. Rest assured that there are particular regulations in place just prior to starting the athletic events that include measuring blood pressure at regular time intervals just prior to the event. Now, if the athlete can't bring their blood pressure down at those regular time intervals just prior to their event, then they won't be able to compete. And they need to prove that they're not using an autonomic dysreflexic response in order to improve their athletic performance. So that is a lot of scientific information, but what I want you to do is take away the information that includes that there are particularly athletes who have a spinal cord injury who participate in long distance events, and it is a possibility that autonomic dysreflexia can increase their athletic performance. However, there are regulations in place by the Paralympic committees that prevent this from happening in the same realm as the anti-doping regulations. So I think you'll find that information interesting whether you are involved in athletes who have spinal cord injuries, such as myself, such as in the world of physiology, which is the practice of medicine who take care of patients with spinal cord injuries, or if you don't have any scientific background. I think it's important to know that in the Paralympics particularly, there are very specific physiologic responses that happen to these athletes that we can regulate for and make a level playing field. And I just hope that you enjoy the rest of the cross-country coverage here from the Alpensia Biathlon Center. Have a great day!